Good evening, and it's a wonderful evening today here in Bombay. And I think for the first time, we are talking about an extremely important topic, which has evolved because of some of the newer advances that has happened in the area of oncology, which has actually led to higher treatment level and or better treatment level and hence improved survival. But with all these advances comes certain challenges. And these challenges is something today on a 360-degree basis we would like to discuss and bring up some of the challenges and what could be the possible solutions. So as I start this wonderful webinar, it's a challenge as well as it's an extremely exciting thing. The exciting thing is that we are going to talk about something absolutely new, which is for the first time we are discussing here in India. And the challenge is we have got to get it done in less than 2 hours. And we hope that in the next 120 odd minutes, we'll be able to do justice to this topic. It gives me great uh, pleasure to first introduce our set of experts. And I can tell you with all my humbleness and all the enthusiasm that I have, is that we have with us Dr. Mehboob Basadi, who is a senior medical oncologist in Mumbai. He's associated with the Jaslok Hospital, the Saifi Hospital, and has been a brilliant practitioner for all these years. Whenever I've heard his patients talk about his own contribution to them, it has been exhilarating. And the other person has always been extremely close to my heart. It's Dr. Nagaraj Huilgoy, senior radiation oncologist from Nanavati Hospital. When we speak about doctors and we speak about connects, I think Dr. Nagaraj really exemplifies that. And it is extremely wonderful to have these two brilliant oncologists with us to share their perspectives, thoughts, as we build this extremely new stream called as supportive oncodermatology. But adding to them is Dr. Asin Maurya, who also is a doctor from an academic standpoint, but decided to move into research. And he spent a huge amount of his own time in Switzerland in basic research, doing formulation development. And I think we attribute a great to our own novel products that we have come out with to his research and the research that his team has done. As we do that, we are, I think, having one of the most very beautifully diverse panel members. To lead that, we have Ms. Tangam Gomez. When I was first introduced to TG, as we call her, I was told that she is the Bhishma Pitamaha of nursing, which basically meant on to say that today, if there are nursing leaders being groomed in India, she's taking that pivotal role in grooming the nursing leaders. We also have with us a extremely beautiful person, someone who touches your heart the moment you meet her. That's Miss Saili Kadam. She's senior onco nurse at the Jaslok Hospital. But I can tell you, when the way she interacts, the way she shares her knowledge, I think these are gems of knowledge which I think can benefit each and every one of us. We have with us Miss Jayatri Mandal. Jayatri is among the very few psychologists in India who has academically qualified herself as a psycho-oncologist, which means her area of psychology is purely focused on oncology patients. And earlier she worked with the Indian Cancer Society. Now she's the senior psycho-oncologist with Four-Base Care. And I think she's doing some brilliant work there, especially in terms of making patients extremely happy and live their life to the fullest. So we have Jayatri with us. And then we have actually three people who, in my view, have inspired what Vidhyou is for. Because it's at the end of the day, the belief. And I think when we meet Tulsi, Natasha, they exemplify the core belief of Vidhyou. Because at the end of the day, it's our mindset. to battle it out, because challenges come, and we believe that if we are alive, then challenges is a part of us, and it's the way we actually face these challenges that define us. And I think when we first met Tulsi, it just wasn't a delight, but it gave us inspiration in terms of what we were doing. She is a breast cancer survivor. She had this at the age of 33. Now it's 6 years. But what's beautiful is she has climbed Mount Everest. She has climbed the base camp of Mount Everest, and she just inspires the way she kind of puts across her perspectives. Natasha, who herself is an extremely senior executive in Sony, she herself is a brilliant inspiration, very bold, and believes that life is worth living every bit of it. We have also with us Prachi. Prachi is a caregiver, and I've seen the way she has worked it out with her father. We all know that this challenge of cancer is not an easy challenge. But if you have someone with you, and I think Prachi has been with her father all through and through. And I think the other day when we were speaking to her father, the kind of pride, the kind of happiness that he showed, with Prachi being with her, I think talks a lot about her contribution to her father's recovery. Then we have three extremely important people from the industry. We have Garima Vyas, who's the regional head of Paxman Scalp Cooling, which is doing some excellent work here in India, especially when it comes to the area of hair loss in patients undergoing treatment for cancer. And we have her here to talk about her perspectives as well. And then we have two extremely important people who actually have been the reason why Vidhyou is what Vidhyou right now. And that's Amit Uplekar, who has been from day one. It's now been more than a year where he has been looking at every aspect of making some of the products that is extremely safe and effective for cancer patients. And we have Vishal Sadwilkar, who heads the entire commercial operations for Vidhyou. And I think with great enthusiasm, I'm humbled by the people who are together here, and I believe that it will make a big difference to all of us. So with this, what we are going to do for the next close to less than 120 minutes now is to focus on the largest organ in the human body, and that's the skin. So when we speak about skin, for those members in this group, and we have a lot of patients and caregivers also joining us, it basically means the skin, the hair, and the nails. And I think all the discussions will revolve around some of the challenges that we see in this area. But more importantly, we then focus on how do we look at possible solutions and how do we look at the future. I will have a quick pause here, and I will pass it on to Amit and Priyanshi, where they have something for you before we go into the main discussion. Over to you, Amit.
Hey, Chetan, thanks for the wonderful introduction. I think warm welcome to all the experts and the wonderful panelists. I think we are really very fortunate to have them on our webinar today. And thanks to all the attendees for logging in on time. So before we begin this wonderful journey, we would like to take a small poll. It's a simple poll of 5 to 6 questions which will pop up on your screen, and you just have to click the correct option. This will give us a wonderful sense of the understanding, of how you see this dermatology and oncodermatology and skin related products. And then we will proceed forward. Just to tell you that there are these tabs also available, where you can go for a survey and product availability. But right now, Priyanshi will start popping the questions, and you'll get about 20 minutes to answer, 20 seconds for each answer. So Priyanshi, can you pop up the first question, please?
Yes, sure.
Thank you.
Amit, you may read out the question if you think it'll
Yeah.
be.
So products which claim to be dermatologically tested or gentle on the skin are definitely safe for people facing cancer and cancer survivors. You just have to choose whether yes, no, or whether you're not sure. This is the next question regarding sunscreens. So, which type of sunscreen is recommended by dermatologists for people facing cancer and cancer survivors? Again, there are four options: mineral sunscreens, non-mineral sunscreens, any sunscreen of popular brand, and not sure. If you're not sure, you can just hit on the not sure tab. This is the next question. Do you know of any brand of skincare which is customized for people facing cancer and cancer survivors? So if you know of any such brand, then you can hit yes, I know. If you don't know, you can go for no, I don't know. And if you know about the brand, but it is not available in India, you can click option C. And if you're not sure, then go for option 4. This is a question where you will have to write the name. So according to you, which are the 3 most gentle and safe daily use skincare brands? So you can write the names of those brands which you think are most gentle and safe in your opinion. So you will have to type in this information, write the name of the brand. Priyanshu, maybe we can wait for 10 more seconds since they have to write this particular information.
Okay.
Yeah, I think Priyanshu, we can close the survey. That's it. And over to you, Chetan.
Thanks a lot. Now, I think what has come out of this small survey would be the general understanding that we have in this area. And to move forward, I think I'll now put across a very important aspect, which I think today each one of us is facing. Now, if you look at this slide or these hotspots on the India map, basically shows all of us that how cancer is now the incidence of cancer is actually increasing. Two things are attributed to that. One definitely is better diagnosis, but the second is that the overall incidence is increasing. And I would love to get perspectives of Dr. Mehboob Basade first and Dr. Nagaraj there on what, according to you, is leading to these changes in India. Dr. Mehboob?
Yeah, thanks, Chetan, for inviting. And really, this kind of webinars are really important from our perspective as well as from the patient's perspective, so that we take care of in toto of the patient rather than just the medical or surgical or radiation management of the patient. Yes, we know that the cancer incidence is rising, and not a single one is attributable to it, but it's a variety of causes. Variety includes the obesity, less exercise, smoking, tobacco chewing, and nowadays everybody is becoming potato out, no exercise because of the mobile, everybody's there inside. So all these factors are also contributing. Pollution is there, which we all know that it is increasing in Mumbai as well, apart from Delhi. So all these factors are also contributing to increasing the incidence.
Thank you. Dr. Nagaraj, anything in specific that you have seen because of all these years that you have been practicing oncology? Uh, what are the main changes, at least in your OPD, that you're now seeing, which, say, for example, 30 years back you wouldn't have seen?
Yeah, okay. Now, let me say that I'm in the private sector, so the kind of patients that we see in private sectors do not necessarily reflect what you see in the statistics. Well, what are the main differences? Um, uh, I do see a lot of head and neck patients. I do see a lot of breast patients. I don't see many cervical cancer patients. And since I do have a certain interest in neuro-oncology, maybe that's one reason as to why I do tend to see quite a few brain tumors. But as Dr. Basade rightly mentioned, quite a few reasons. Another reason is our average lifespan has gone up, which means we're more and more susceptible to cancer. Average lifespan for male is around 70 plus or something, 69 odd, and similarly for females. So what was 37 post-independence, we are nearly there. We live for 7 decades. So there's well, besides what Dr. Basari said, and also, I mean, our infrastructure is much better. What was initially treated probably as tuberculosis is now investigated and properly diagnosed. And those facilities also have increased, and there's a better access to healthcare. Not satisfactory, not ideal, but there's few of the additional points which I should add to increase diagnosis. And as I said, in my private sector, increased incidence of esophagus, breast, and head and neck cancers.
Wonderful, wonderful. So there was a time when cervical cancer used to be higher, but now I think it's moving to more lifestyle related. So breast cancer is now seen at a higher level, especially in the urban setup. Thanks for sharing those extremely beautiful insights with the team. Now, the thing is, with increased incidence, we also have seen that there has been a remarkable uh, change where now more people are beating cancer than what they would have done earlier. I remember way back in 93, 94 optics when I first got into oncology, selling oncology products. And those were the times when I used to come and meet both of y'all. We had very limited options when it came to treating cancer. But now I think what started with very few chemotherapy went on to a huge variety in the number of chemotherapy drugs, and then moving on to what we call it as targeted therapy, and now, of course, immunotherapy. I think what we have also seen is an advent of precision medicine, and what we are now seeing, and I think the West is definitely, I think we are getting a little westernized because of various things, the way things are changing in India. But what is now seen is that the survival, at least in the West, they say that the survival has doubled compared to what it was in 1970. And now when you look at it, with more people having cancer or having incidence of cancer, and with higher survival, what in your practice has led to this major change of increase in survival? One, of course, better understanding of the disease. So I'd like to get Dr. Nagaraj, your thoughts on what's in your view, even in your private setup, which is a significant private setup, that you have seen that has changed over the last 3 decades.
I think, especially as I said, in a private sector, you do say, just take an example of breast cancer. I really do see very fungating masses, which I used to see in the 80s. So there has been a shift in the stage that has been downgraded. That is why we do tend to see more and more earlier cancers, both in head and neck, maybe even cervical and breast and many other lesions. Not necessarily because we have some incredible screening programs for some of them. Now, prostate, yes, because I think, as a part of the executive packages, etc., a lot of people do a PSA very routinely. So, as these executive packages also have had an impact on early detection of prostate cancers in urban area, again, urban private sectors. And I think, again, I know it's very patchy. The access to healthcare and access to doctors has made the diagnosis feasible, and more early diagnosis is being done. Not for all sites, but some of the sites in some of the area. It's highly heterogeneous, patchy, and in some places it's really good, in some places it could be much better. So there's some of the reasons as to why I think we do have early diagnosis, and that has changed the way the patient to survive. I think one example, I think, where Dr. Prasad will definitely can give more insight is something like lung cancer, wherein you have newer drugs. And when we started practice in 1980s, lung cancer was supposed to be an incurable cancer. In a sense, you did nothing, or even glioblastomas, you did nothing. But the addition of certain, molecules like temozolomide, or some of the immunotherapies, or some of the combination chemotherapy has definitely, along with the latest techniques and technology in radiation therapy, and to an extent surgery, has had a tremendous impact on increased survival.
I think what you did mention, I think the kind of changes that we have seen, especially in the medical oncology part, has been significant. So, Dr. Basade, if you could share how you have seen the entire approach change over the last 3 decades, and how do you attribute that to improved survival? I think we would love to hear that perspective.
See, improved survival will be seen if you detect the patient very early. And what Dr. Nagaraj was saying, that the early detection is the most important. Awareness has increased. That's why we are seeing like very few of the fungating breast cancer, what he was mentioning. That is one about the breast cancer, but there are certain other diseases where we still see in the advanced stages. What has dramatically changed is the understanding the nature of the disease, what we call as a biology of the disease, why this cancer is happening, what are the genetic mutations behind that, what is the interaction of that genetic mutation to the disease progression, and how can we block. We have particularly understood from a disease called as CML, chronic myeloid leukemia, where there is one single gene, there is a defect. That is what we call as a Philadelphia chromosome. And it was first what we call as a designer drug. That's where the targeted therapies have come in. So it has been designed in the laboratory, or you can say in the office, that if you revert that, they probably that cancer can get cured. And exactly that has happened. And from there has been a revolution in the therapy for the chronic myeloid leukemias and for other cancers also. And incidentally, the CML is the first disease where it was found that it is related to a genetic disorder. And the first treatment also came in CML. So it's important from that perspective. And now as we have progressed further with the targeted therapy and immunotherapy, as we know that if there is a single gene effect, yes, we can target it properly. If there are multiple genes which get involved, then it is a little difficult to control that kind of disease still now. As Dr. Nagaraj was mentioning about the lung cancer, now I can give one example of the advanced lung cancer patient. If somebody has got what we call as an ALK gene mutation, ALK gene mutation, previously this patient you were surviving at most 1 year in the advanced stage. But now their survival has reached median, what we call median average survival is somewhere around 7 to 8 years. So that much leap has happened in the advanced cancer stage, last stage, stage 4. People are living normal life with one single pill, and they are living for years. And there are few patients who have seen the decade also. So that much change has happened. Otherwise, even 10 months to 1 year was difficult for such patients.
Wonderful. And I must actually, attribute some of these things with the high amount of focus that has now increased after the understanding of the human genome. And now with precision medicine and on all the other treatment that's now being coming into picture, I think we will see an exponential increase or cancer over a given period of time being a chronic disease rather than an acute problem, which it used to be once upon a time, which means we will have to then live with the challenge. Like if you have a cardiovascular problem, you get your angiography, angioplasty, but then you live with it. You have diabetes, you live with it. You have arthritis, you live with it. And so now we'll see a lot where patients have cancer, but they live with it, with remission, where you don't see the disease. So I think these were extremely important aspects as we move into what we believe was the core belief of Vidhyou. Because when we started, Vidhyou started with an idea, and the idea or the belief was that we will face challenges, and I think challenges are a part of us. But it's how we embrace life with confidence, grace, and of course a smile. I think is what eventually makes difference. And I think Dr. Basade and Dr. Nagaraj, I think in your own practice you would have seen a lot of patients where those patients who had a positive outlook towards life, they had better survival compared to those people who had given up. And I think it's that conviction and that drive of life worth loving again is what became the central theme of why we decided to form this part of the journey for a lot of cancer patients. And it was that belief which for us was very important. So given that, we now move into the science part, and I think this is where we will move into a higher decibel of conversation. And the first part is that as we see advancement in treatment and as we see advancement in technology, we also see an improvement in survival. But then each of these have their own set of challenges. And I think many a times when we speak to a lot of cancer patients ourselves, what we hear from them is we knew that hair will fall, but other things we were not aware of. So there is an element of the unknown, which I actually started hearing, especially from the patient side. But I think it's extremely important that we understand that as we look at these treatments and they make a big difference in survivorship, there are certain challenges that come along with it. So, Dr. Nagaraj, radiation is something that I think, or radiation therapy is something that you have been administering to, I would say now, lakhs of patients over all these
Oh,
years.
okay. All
What
right.
are some of the common?
Yeah, see, like what happened was in the auto voltage era, skin was a big problem, and then we came into mega voltage, and we got over the, we pushed all our side effects beneath the skin, and now again there's what we call as the intensity modulated radiotherapy, and not many people realize that really skin gets much more dose than what it used to be. So we also have drugs like cetuximab, which is sometimes added to radiation therapy, or even any of those maps which have a cutaneous component as a side effect. So we do now, in spite of the fact that we have much better technology, but in certain sites, especially in head and neck cancers and breast cancers, skin reaction can be dose limiting. Of course, alopecia is a different ballgame. Only when we treat cranium, like for brain tumors, they do all come back much later. But then that's relevant in low grade gliomas. But having said that, the skin is back in focus. Skin and subcutaneous tissues, and we need to address them. And this is both, let me tell you, even for protons, skin reactions may be a bit of a hassle. I mean, so it's not just for photons with IMRT, but in certain sites, but even for protons. So this must be kept in mind. So we're back to skin as a dose limiting toxicity.
So in in your current practice, what percentage now, since the relevance has again come back on skin, what percentage of your patients you would normally see a skin-related adverse effect?
So as I said, most of the head and neck cancer patients, when you treat for a radical dose and especially chemoradiation parts of it, they are most nearly 60 to 70% end with not just erythema but moist, dry to moist discoloration, and sometimes very bulky breast cancer patients, and of course again sometimes in the pelvic tumors, etc., etc. But predominantly it's the head and neck and the breast which can give you a tough time.
Dr. Basadi, we have seen a huge, and I think the next three columns are I think your area predominantly in terms of domain, and many times patients do have this challenge, saying that that they have maybe hair loss could be one of the issues because that's probably known and it's more visual. But what have been the challenges that you have seen in your practice?
Initially, we started patients treating with chemotherapy. And I must tell you that there is no new chemotherapy drug which has come into the market in last 20 years. So chemotherapy era is getting over. So what we are going to get more are the targeted therapies and immunotherapies and what we call newer one like ADCs, antibody drug conjugates. So these are the newer things which will come into the practice, and the patient will be receiving a lot of these drugs. But we still use chemotherapy, and everybody is aware the first and most common side effect is the hair loss. That majority of the chemotherapy drugs, not all, majority of the chemotherapy drugs, there are certain diseases where we give chemotherapy, but there is no hair loss. But everybody thinks that probably when they are going to receive chemotherapy, there is going to be a hair loss. It's not true. Skin dryness, skin changes are very common. Hand-foot syndrome, typically the patients when they receive 5-FU related, like capecitabine is a drug what we use in breast cancer, colon cancer, they have a lot of problem in the hand and the foot. That's called as hand-foot syndrome. There is a dryness, there are cracks, there could be bullous formations. Many hand reactions are very common in that. Skin discoloration, patients, the color becomes little blackish, not necessarily blackish. The black is not the only one, but even in some patient, especially when they have a kidney tumor and they are receiving sunitinib, it becomes yellowish. The pigmentation could be yellowish. And if the patient, like I mentioned, the chronic myeloid leukemia and CML, if they are receiving imatinib, they become fairer. So right from fairness to the blackishness. So both the ends of the spectrum we get when we start the patients with some sort of therapy, whether it is targeted therapy or chemotherapy. But I must tell you that, with this targeted therapy and immunotherapy coming in, there are two new oncology branches are coming in. One is oncocardiology, because they have a lot of heart-related effects, and oncodermatology. That's what is we are discussing. So they have a lot of effects on the skin. So these are most important things what we do. If somebody is on the sunitinib, like which is a targeted therapy, or sorafenib for the kidney cancer or liver cancer, a lot of troubles for the patients, for the hand and the foot, especially their nails also become, they people lose the nail and there is a pain, there is an infection. Pretty bad, I must say that. We always explain to the patient that these are the things which are going to be nasty, and you have to be mentally prepared for the things.
I think what you just articulated, Dr. Basadi, is the challenge today. And I think what you rightly mentioned, that with improved survival comes its own challenges. And so the area of oncocardiology, because there is an impact on the heart, and oncodermatology, I think these are two evolving sciences that today, I think when we even look at some of the work that's happening in a Memorial Sloan Kettering or an MD Anderson, there's a huge relevance to these two areas that is being given by these institutes as well. I think here now, I think we'll open up this conversation to now we have Jayatri. Jayatri, she is a senior psycho-oncologist. many a times we attribute, Jayatri, the challenge of the skin to the skin. But being a psychologist, what are the challenges that you have seen, and does these skin-related adverse effect impact the psychology of the patient?
Yes. First of all, good evening, everyone. Mr. Chetan, coming to your first question, that usually what are the main things that I have considered or even I have heard from the patients during the counseling session? The first thing is that my skin is very dry now. There are so many rashes also. There are some itching sensations. So I must say that as per my clinical experience from a psychological perspective, the itching sensation and the burning sensation, sometimes dryness. And now this is the winter season. So whenever I take any counseling session, the most important, these 2 points only comes up, that what needs to be done. And the another thing that, as you said, that alopecia, yes, the alopecia is very, very important here, particularly for the women who are working. So sometimes they're taking chemotherapy or any sort of treatment, and now after that only they're going back to their office. So there they experience a lot of, I must say that sometimes, the stigma or sometimes isolation as well, or not so much comfortable in a mood to talk to the other colleague. So yes, sometimes I've seen many people even quitting their job just because of alopecia, because they do not want to face their colleague or not even their neighbors. They start isolating themselves inside a home. So all these things, yes. Coming to your next question about effect of the skin problem on the mental health, yes, it's truly huge what I felt even during the counseling session, as I said earlier as well. Many patients, many women, particularly who are working, I have seen many of them, they stopped going to job and even going to outside, even for the market or shopping mall, just because of skin problems or alopecia, skin rashes and discoloration of their skin and even nail as well. So it sounds very small probably for their family members to a certain extent, what I have experienced, because the treatment is the major goal here. So why to take care of other part? But whenever I counsel them face to face, for them, it comes at a huge challenge.
Wow. I think what you just explained are things which are never seen in the front, because what you see is the skin related, pigmentation or, depigmentation. But then it could be a acne like rash, or it could be itching, or it could be something like a hair loss. But how it can psychologically impact the patient. And since not all patients are really tough, it has different implications on different people. Here, I'd like to get in Ms. Tangam Gomez, who herself has been in the area of critical care for many years and has trained multiple nurses. What are some of the challenges that you see in the nursing community when it comes to seeing patients with these kind of challenges?
Thank you, Chetan, and it had been a pleasure listening to all the esteemed speakers here. Though I'm not an oncology nurse per se experienced, but I have headed hospitals where oncology services were being given. As you started in the beginning, skin is the largest organ in the body. And it is a problem not only for onco patients. There are many other in the conditions where the skin becomes a problem. Even a normal person like me may not, adapt to any lotions which is there, and I could have problems with my nails, skin, and hair. So we all worry too much. And closer to home, my aunt had suffered from ovarian cancer. And I know for one that it was very difficult answering her questions about all these things that you were discussing, apart from the side effects of the chemotherapy, the questions about why my skin is becoming like this, why my hair is like this. And as our psychologist friend just mentioned, losing hair, she didn't want to meet anyone. She said, I don't want any visitors to come and meet me. So these are all the things that the patient themselves, they suffer, and also the caregivers, not only the family members, the doctors, the nurses. Nurses in particular are very much aware of what is happening, because patients, they tend to share those very intimate concerns with nurses. They will tell, what can I use for this? What can be done for this? They are hoping that, with their experience, they will tell some personal advice to them. And I must tell you that this is the first time that I have come across any company, whether outside or in India, focusing on, manufacturing products which are very specific for, such sensitive skin, especially in the onco patients. This is probably the most overlooked domain, because everybody, when they think of cancer, they only think, I need to just survive this, I should be alive, I should not die so quickly. Now, with our esteemed doctors telling that the survival rate, which was 50 percentage maybe in 1975, as per records, now it is more than 80 percentage, and in some of the cancers it's even better. So when they survive, do they need to suffer all these skin related problems, worrying every day? That's a big question. And that's the question that is being answered by Vidhyou. And I'm sure that as we move forward, we will hear more about the solutions, about the problems that we are discussing. And I am very, very happy to be associated to know. And I'm hoping that more and more nurses will get involved in assisting patients and their families to deal with these kind of problems apart from the side effects of the chemotherapy. I'm really looking forward to that. Nurses will play a pivotal role in that for sure. Yeah. Thank you for asking me this question, Chetan.
Wonderful. And I think the way you have articulated, the relevance element, because when someone has cancer, it's not just the person having cancer. It's the entire family that suffers along with the patient. And we were speaking about this to Natasha. So Natasha has raised her hand. Natasha, over to you.
Uh, Hi, Chetan. Thank you so much. Chetan, I noticed that, there is one point that I don't see on this slide. My experience post chemotherapy, I suffered from a heightened sensitivity to certain smells. So everyday scents that were once benign now trigger intense emotion and memories associated with my treatment. So I virtually picturize me on that hospital bed, and it's such an unsettling feeling. So just to cite one example, I used to use a medicated cream for the dryness, and post my chemotherapy, I don't even want to look at that bottle because that smell has triggered so many uh, difficult memories, and it transports me back to that chemotherapy room. So I don't even want to look at that cream anymore.
I think something extremely important. Dr. Basade, would you like to?
Chetan, I think she has made a very valid comment, and that's why there was a time when I had instructed my staff not to spray any air fresheners in my room, or even the room, so that the people don't associate their memories with any smell. They can trigger, as she rightly said, and a very important point. That's important because it will help you as to whether you should have a cream which is smell neutral or which must have some smell. She has made an excellent point.
Beautiful, beautiful. Thanks, Natasha, for bringing that up. I think Dr. Basade, any thought
Yeah.
that you would?
Yeah. I mean, I absolutely agree with Natasha what she said, that memory, thinking back of what has happened. So we very oftenly tell our resident doctors, junior doctors, that it has been reported previously that, chemo associated with chemotherapy, there is a lot of nausea and vomiting. Previously, there was a huge, now the number has come down. So she said about the smell, I'm talking about the nausea and vomiting because it happens. So there is a report which is mentioned that one patient, she used to get a lot of nausea, vomiting, saw her doctor after 15 years in the market and she vomited there.
Oh.
Just she looked at him and she was reminded of those memories, and she vomited in the market. That kind of a fear, psychosis is there in the patient's mind. Let me tell you and assure to the patients that the things are improving a lot, but having some fixation that, it reminds you back, over a period of time, you have to let it go. say that, okay, it has been done, let it go, let's come back to the normal life. I know that it may be very easy to say these words, but you have to be in the real life, सच्चाई में तो जीना है. You have to leave certain things and move ahead.
No, I think, but I think it's an extremely important point. I still remember, in one of the cases at Tata Hospital where this patient had vomiting, and the next time he got down at Dadar station, just the thought of getting down at Dadar station, induced vomiting. Just
Yeah.
because the smell at the other station was reminded him of going to Tata Hospital. And I think that's an extremely important point. We have Saili here. Saili, what are some of the challenges that you see? आपको क्या मतलब problems है जो आप patients में देखते हैं? Saili? आप म्यूट पे हो.
Can you hear me?
Yes, of course we can. Lovely to
Thank
hear
you,
your
sir.
voice.
Thank you, sir.
Yeah.
See, patients, when they come to the chemotherapy room, when they come for the chemotherapy, we just tell them they have fear in their mind, and they come to, there are many side effects of the chemotherapy drugs. We tell them that you will have alopecia, you'll have skin changes, and there are a lot of side effects. But when they go home and when they come for the next session and they actually have it, that is really a shock for them. So when they tell sister, see, my hairs have become very. Sometimes when they have a short chemotherapies, I mean weekly chemotherapies, so they will have a less alopecia. So their hair will lose. They will have less, but hair will become very frizzy. So they want some solution for that, and for they don't open up with the consultants. They ask us what is the solution for this. So we sometimes tell them that you use good shampoos or you use oil, but there are no precautions for skin changes. So we must tell them, see, after taking chemotherapy, you will have all these side effects, and we should prepare them for such changes so that they will have idea, and so we prepare for them for the changes, and we should give them the solution.
I think you just mentioned a very, very important point. I was speaking to someone the other day, and they said that now, because I know that I am going to have this problem, I can prepare myself better.
Yes.
Many a times
But
it
their
becomes
hair
more because I
their
don't know
skin
what is
become
going to hit
dark,
me.
their skin become dark, their nails are brittle, and darkening of the skin, and they are really, it is shocking for them. So we must sometimes we tell them you use these moisturizers, this.
Wonderful. Thanks a lot. I think that's an absolutely practical thing that you have been now seeing, being an onco nurse for more than 25 years, and I
And
think
there are
that
certain drugs also, sir. There are certain
yeah,
drugs which causes like capecitabine and all. They cause hand and foot syndrome. So we, after after taking capecitabine, some of the patients they develop skin eruption. All. So we tell them, so you have to use it hand foot. That is a hand foot syndrome. So we have hand foot creams available in the market. So I think suppose if we tell them ki before, if they are on capacitama, if we tell them to use such and put cream which are available in the market, I think that will help.
absolutely. So here I think we will now get into some real life stories, and I would like to invite Tulsi, who has been a cancer warrior, and I think her story has just been inspiring to all of us. So Tulsi, can you share with us when you got your first chemotherapy and you got your first treatment? What were the challenges that you saw on the skin? And what is your story? And I think that will be something interesting for all of us to know and understand.
Thanks, Chetan, for having me here. I'm also very happy to have Saili here because she's been my onco nurse at Jaslok Hospital. So, Chetan, my story started when I was 33. I was diagnosed with cancer, And the first treatment that I got, obviously we were told about, hair loss, which is something that you anyways expect with, with chemotherapy. But given the fact that when like there was one point that you made that now that I know, I'm more prepared or better prepared for it. Similarly, for me, I just felt as if I shave my head myself, it gives me that confidence that I'm doing it myself and it's not the cancer that's taking my hair away. So that was definitely one of the it just gives you confidence when you know certain things. Chemotherapy, the first time around, I was extremely tired. I was extremely not sure about what was happening. Lots of changes in the body. My nails had gone completely black. I could probably count every single chemotherapy that I took on my fingernails. Um, there were lots of feeling nervous, not sure of what is going to happen. My skin got really brittle. My skin was really, really thin. Um, and I remember getting a massage every single time after every chemotherapy. And there was this one time when the masseuse was giving me this massage, and suddenly I had this long cut on my foot. And I was very upset about it because it was bleeding. And it was only later when I spoke to Siley that she said that it's because your skin has gotten really thin. So it's not anybody else's fault, but it's what chemotherapy does. So yeah, I mean, those are the changes that actually happened. And there are a few things that I would like to tell you about my cancer journey as such. The first question that a lot of people ask when they know that they have cancer is why me. But in my case, I always felt as if I'm the chosen one to be able to talk about it. And also, I just feel like when you read blogs, and um, when you just read about chemotherapy and cancer and how life is going to be after cancer, you are always told that you won't be your old self again. And that is when I chose to, be the 2.0 version of my old self. Just the way you have, a software upgrade on your phone. It's similar to that, where it's a software upgrade to myself, where it's like a restart or upgraded version. And that is when I chose to do, the Everest Base Camp trek, because I wanted to show the world that you can be a better version of your old self, stronger, mentally stronger, and just come out happy, And so I think my slogan for, right through chemotherapy has always been happy vibes. And having the right people, having the right nurses, the right doctor, like Dr. Bijoy was really, really, my guiding force. Dr. Ritu Jain and, Amish Talal, they were just there constantly, and it's just nice to have someone to be able to talk to discuss your problems with. And yeah, that's just how it's been so far. And I do feel that I have come out a better version of my old self, stronger and happier for sure.
I think you have been a phenomenal inspiration to all of us, and I think when you said that I'm growing my hair so that I can donate my hair, I think that itself, kind of talks volumes about the way you have believed in yourself. And this is what I tell you. I tell Natasha that you guys are the ones who basically make us feel that every day that we do our work, that we that's the mindset that we are working towards. So brilliant. I'd
Thank
like
you.
to know, and thanks for that. I'd like to get Prachi. Now Prachi has been taking care of her father, and I think she has also been seeing a lot of skin-related side effects. Her father is a patient of rectal carcinoma, but she has been seeing her set of challenges. So, what has been your view as a caregiver, Prachi? Uh, I think we must have lost Prachi because she was traveling because her father was supposed to get his consultation done. But I think we will now move on uh, to Garima. And I think Garima, I think, is doing some fantastic work, especially in the area of alopecia, especially when it comes to patients post chemotherapy or post other cancer treatment. What have been your observation as the person who heads the India business for something like scalp cooling? What has been your experiences that the patients have shared with you?
Thank you for giving this opportunity, Chetan sir. And it's really nice to be along with all the respected clinicians here and the panelists, others. So before I go in, I think Thankum ma'am has some question to say. Is it she's raised her hand?
Yes.
Thank you for recognizing that. I just wanted to give my hats off to Tulsi. When Chetan was mentioning that, we always have something to complain about every day, right? But when we listen to people like Tulsi, I always say thank you for bringing Tulsi here, because life is a gift and you made us realize that it is so precious. And I definitely don't have any reasons to complain when I listen to Tulsi. So thank you, Tulsi, for that. And thanks, Vidhyou, for bringing such cherished people back here on this forum. They are such great motivators, not only for patients and families, but even for people like us. This is very, very important. And this is the high point for me today, listening to Tulsi. God bless you, and thank you so much for being here.
Thank you, Thangam. Thank you so much. I'm just happy to be able to share my story. I have lots to say, but I'm going to keep it short.
Thank you.
So thanks a lot, Tangam, for that. Over to Garima. Garima, your part of
Thank you.
the journey and the story.
Thank you. It's indeed very inspiring to listening to each and every respected participants here. And as rightly said, that yes, I head the India business for Paxman Scalp Cooling, and scalp cooling is a technology which supports to prevent the chemotherapy-induced alopecia. As each and every respected panelist said about the alopecia, the main cause, and the taboo related with the alopecia. So while we give the scalp cooling, the patients are giving the hope that they will be retaining almost 50% of their hair volume, and also will get the faster hair regrowth, which is a scientific and evident. Now, when we say about that we are going to give you the 50% hair is retained, and they will also get a faster hair regrowth, which has been published in all our 80 clinical trials, the point comes the quality of the hair care. Because even during the chemotherapy is going on alongside of the scalp cooling, the hair care is very important. So the major questions, as rightly, Saili was talking about, that the patients ask which products can we use. So this likewise, the scalp cooling and the chemotherapy, because see, chemotherapy drugs causes a lot of dryness in the hair, and there it becomes brittle, thereof it falls off. So they need that kind of the products which they ask to retain their hair, to maintain their hair, and have a good, healthy hair growth. So all these factors are the challenges which a chemotherapy patients, while undergoing a scalp cooling as well, they do ask us. Scalp cooling is preventing their hair, but is the hair care products sufficient for them to maintain a good, healthy hair? That's more important here. So therein they ask us a lot of questions about which products they can use.
Thanks. And I think, and that's something which is extremely important, because if something like a scalp cooling is then with the patient not knowing that they are using certain shampoos which have those irritants, it could then have a rebound effect, where all the good work that the scalp cooling does, then when the care element happens, then there are challenges to it. But I think very, very well articulated, Garima. We have Natasha here. So Natasha, you mentioned about the sensitivity to smell. What other things did you notice as a patient when you got your treatment done, and what were the things that took you by surprise?
So first and foremost, I wasn't as strong as Tulsi. What happened was, my brother-in-law was super positive that, like one of the doctors mentioned, some of the chemotherapy medication does not impact hair loss. So my brother-in-law was super excited, and he mentioned that Nats, nothing will happen to you, don't worry. And I don't know why, I was 100% positive that I wouldn't have hair fall. So I hadn't washed my hair for a week because I was operated because I had a port. So I went to Enrich, which is a local salon in the vicinity. And I told the beautician, please wash my hair. And then she kept washing my hair. And then she's like, madam, aapka baal gir raha hai thoda. So I said, yeah, because I've not washed it for a week. And then from the corner of my eye in the mirror, I could see chunks and chunks of hair just falling. And I just did not know what to do. I don't know why that day I wore a hoodie, and I just ran out of the salon, and I came back home, and I called up my brother-in-law's brother, and said, please, he's bald. So I said, you know how to shave your head, please come home and do mine. And while he was doing that, I called my mom as well, and she had tears in her eyes. But then I said, I have to be strong because I had beautiful golden locks and I wanted to keep that, but then I could just see it falling. And then I didn't want to see myself at all. So I made my family members cover all the mirrors in the house. And I think it was there till my chemotherapy got done. But fortunately, besides that, I didn't have any other side effects, barring the sensitivity.
You did mention about bad body odor post chemotherapy.
That was post my second chemotherapy because I put on almost like 3 to 5 kilos every chemo cycle. Towards the end of my 12 sessions, I went in at, I think, 55, and towards like today I'm at around 75, 80. I think I don't even have the guts to go on the weighing scale anymore. And because of that, I have dark skin, like under my arms, around my neck. I notice certain skin tags. So now gradually they are subsiding. I can see that my skin is becoming a little lighter. That's it.
I think Tulsi wants to say something to you.
Natasha, I could give you a hug right now. This was really like I just teared up with what you mentioned. But when Natasha is talking about body odor, it's real. This is like, I know going through chemotherapy, and suddenly I would just be able to smell myself, and wonder why there was this smell around me constantly, and so yeah, body odor is something that that happened excessive for me, and because I was also going through Zoladex, the injection which is a hormonal injection, because of which I would just have excessive hot flashes. I would probably have 20 hot flashes a day, which is a severe case of hot flashes. And, that would just cause all this heat, pent up heat, and it would just erupt pretty much.
I think, as Dr. Basadi and Dr. Nagaraj did mention that, when you look at this chart, it basically tells that there are challenges. So, and when we look at survivorship, and I think that's the key thing, once we have achieved that, how do we take care of, the life per se? I think both you, Natasha, I think have been that, though Natasha, you mentioned that I'm not as strong as Tulsi. I can tell you are as strong as Tulsi. And I think that is what eventually makes the difference of the life that we live. With that, I would now actually move on with these challenges that we talk about, which impacts everyone. We basically now move into how these side effects impact. But Priyanshi, we have someone who has raised her hand uh, um, from the audience. Can we get her question, please?
Yes, sure.
Hello.
Chetan ji, we don't have received any question.
Okay, but I think she had raised her hand. So if there's a way
Um,
to get her inputs, we can then have it. But in the meantime, we will move into two things which I think we are currently all discussing. One is it impacts the treatment, which means there are times when the doctors are not able to complete the treatment because of the side effects. Second is, and this is what we have seen with some of the targeted treatments like cetuximab, which has got huge rash-like reactions. And then in some cases, you have a reduction in dose because patients are unwilling to go through those side effects. But I think the one thing which I think comes out very commonly among with all the patients is the fear of treatment per se, which means they have undergone the first cycle or the second cycle, and in the third cycle they don't want to continue. It's not that they can't continue, but they don't want to continue. So there is a psychological impact that makes them say no. And this is something when we speak to patients does come out very, very loud and clear. And all these then become reasons for either the treatment not being as optimum as what our oncologists would like to have, or it would lead to an earlier relapse. Um, the other element I thought which came out very strong was, I think again, which was mentioned, was things like itching. Even if a mosquito bites us, like at night, we can't sleep. Now imagine if you have itching on the back, and how do you sleep? And so it does create lack of sleep. Similarly, if you have hot flashes, becomes extremely difficult to concentrate on something, focus on something, and it has its own set of distress that we have from a thought process, and hence social isolation, which I think Jayatri did mention when she spoke about the quality of life. So when we look at the side effects, it's just not about on the treatment, but it is also on the quality of life. And given this as context, I thought it was extremely important that we now focus on how do we build our own defense system. And there are two approaches that is now coming up, and I think Dr. Basade did articulate, saying that oncodermatology is evolving as increasing survivorship is making a difference to thousands and thousands of patients. And how do we build it up? So we know that, and I think it was articulated very well in the earlier part of the conversation, that when it comes to vomiting, you have antiemetics that are given even before the patient would go for chemotherapy. You have, growth factors which are injected so that, the neutrophil counts are maintained even prior to we knowing that this particular drug would cause neutropenia. So there's a lot of prevention using steroids, antibiotics, which are done for some of those challenges. But how do we look at the same concept when it comes to the skin? And this, I think, became a huge area of science and understanding, which actually led us to read into multiple uh, international papers, which actually now start telling us, and these are very recent papers, which now tell us that if you take care of your skin in advance, like how you do for vomiting, you take the medication in advance. Similarly, if you care for skin in advance, then there is a great possibility that there is a reduction in skin side effects compared to if you don't take care, which is called as reactive skincare. Which means if I take skincare as a priority only after the skin damage or the side effect has happened versus taking care of the skin prior, there is a big difference in the approach. Given this as concept, I would now get into perspectives from Dr. Basade, saying that how does he see this? Because these are newer advances, as you mentioned. How do you see this, doctor, compared to what it would have been there earlier?
As I told you, the idea of understanding the biology of the disease improved the treatment outcomes of the cancer patients. Similarly, when we understand the biology of the side effects, like skin changes which are happening, nausea, vomiting, or neutropenia, when we know that, yes, these are the things going to happen, we always tell them that, yes, you should start taking care of those in preventing further things. Typically, I know like those patients who are receiving capecitabine that we have been all the time harping on, we tell them that the skin changes will happen, and you don't go into the sun. Whenever you are traveling, you just cover up your hands and foot and face with some, or you use the uh, umbrella or anything like that. Directly don't come under the skin. So preemptive skin care is important. Not necessarily skin care means you have to apply some ointments or lotions or something, but there are other things like not going into the sun or getting remaining in the sunshade, and other things are also important.
Absolutely valid point. And I think with better understanding, I think we'll be able to offer better care. I think that's definitely a very important point. And Amit, can you share, because I think you have been studying this area now for quite some time. What are some of the strategies that are now being shared in the global stage when it comes to skincare?
So I think it is very simple. We always believe and we tell our kids that if you build good habits, then that will result into success. And it is also true over here. Building good habits is extremely important, and there is evidence which has shown that there are researchers who tried to figure out, how can you prevent these cutaneous side effects. And all they say is that you have to build good habits. And as we saw in the previous slide, that prevention is better than cure. So how do you prevent? The beauty of it is you don't have to do something, which is rocket science. Simple things like you cleansing your skin, moisturizing your skin, and as Dr. Basade said, that protecting your skin from sun. If you develop these habits, I think it can really help in in preventing a lot of those skin problems that we heard Tulsi speaking about, that we heard Natasha speaking about. And what is more important, as you develop these habits, you also need to be aware about what type of products to use, because that information, so your habits plus appropriate products, will definitely lead to a better prevention strategy. And there is a lot of evidence, and one evidence we just saw in the slide before, that if you really follow these habits and use the correct products, then it is definitely going to result in lesser side effects. So that is what. So there's no rocket science about it. It is basically about building good skincare habits, right from the beginning.
So here I'd like to get some thoughts from Jayatri. As a psychologist, Jayatri, what stops people from developing new habits?
So in our psychology, there is a term called conditioning, that is classical conditioning. So for example, now you are 30 years old, and since the last 20 years, probably you are practicing the same habit again and again and again. So in your lifestyle, through this process of classical conditioning, that pattern of habits have already been incorporated. So once something is incorporated in your day-to-day life, even if you are aware that, no, if I start probably going for a jogging each and every day for 6 days a week for half an hour, and it's going to give me some good result, even after that, most of us, we are not able to follow that because we are already used to one particular lifestyle or habit. And the classical conditioning has been formed into us so intensely, and that's the reason it's very important or very difficult also to break it down. But again, the question comes that there are some trigger factors. For example, why is more important than what? In psychology, we always say that. So if as like from a psychological perspective, or any well-wishers or any family members or you yourself, if we are able to understand that no, if I really require this to incorporate in my day-to-day habit, and always we say there is a cost and benefit analysis. So if I am able to make my patient understand that if you follow this 1, 2, 3, 4, 5, 6, you will get all these benefits. And if you are not able to follow anything, then surely you will get 1, 2, 3, 4, 5, 6 loss. Now you decide what will be suitable for you. I think if we follow this cost benefit analysis to a certain extent, it's not only about patient, any of us, and we will be getting multiple trigger effects so that we will be in a better position to change our day-to-day habits.
I think absolutely important, and I think when I hear people, you have to develop a very simple new habit, which is of a gentle cleanser. You have to moisturize twice a day, and if I'm not used to that, especially I think in men, I think you will find it more common than women, and protection. Inculcating a new habit, I think then definitely you need some help so that you can have people who can support you in terms of inculcating a new habit, because once they are formed, then they only benefit you in a big way in the long run. So thank you so much. I think there's one question, because Dr. Basade has to leave for an important meeting. So Dr. Basade, how do you see this new habit making a difference to patients? Because these are something extremely new. They have not been discussed even 5 years past. It's more a 1 or 2 year old concept. What are your views here?
To be honest, 90% of our patients don't know. So they have to take care of the skin. I mean, before that, 90% of our patients don't know also the diagnosis also. There are very few Natashas and there are very few Tulsis, such great people. Majority of the patient times, the relatives tell us that don't tell the diagnosis to the patient. So they are not aware what they are going through. So they are not told what to go for that, because again, they will question what is going to happen. And that's how the things start. So there are barriers in the communication, and then the barrier for the skin and other things will come in. So I think, yes, these are extremely important, those who are aware and those who can be explained. And preemptive therapy of anything is very important. You anticipate that and treat it before it happens, and nothing like it. You may be able to reduce at least 70 to 80% of the damage which is going to happen. Yeah, there are certain things which you can't prevent, but yes, at least you can have a tolerable, the quality of life, what you mentioned, that it should remain maintained.
No, I think you're bang on, because I remember way back when ondansetron was first brought into as an antiemetic in cancer treatment. Before that, all patients used to fear taking injections like cisplatin. But with the concept of preemptive care, by giving antiemetics prior to some of these extremely emetogenic chemotherapy products, has made a big change, where acceptance has also increased multifold. So absolutely bang on. I think it's the same concept. When we bring it here with better understanding of science, I think Dr. Basade, you are absolutely bang on here. I would now move on to a question which I think is the question of this meeting. Is that how do you know that the gentle or your preferred personal care products are actually really gentle and safe for you? Because they are gentle and safe maybe for normal people, but for patients who are undergoing treatment, they have immunocompromised system, they have de-stressed skin, they have compromised skin. What is safe and gentle for someone who is normal? How do we know that these preferred brands are gentle and safe for us? And here I would like to bring in Dr. Asin, but before that, Amit, would you like to put your questions?
So no questions, but what I would like to say is, it's very simple. Like, how do you know that the khichdi which the mother prepares for a child when he is ill is safe or not? It's because it is customized, right? She customizes it to his requirement. The spice is customized, the salt is adjusted. She will not give the child something which is very difficult to digest. So there's light food at that time. And that is how you nurture the child back to health. I think same is true about products. So you have to find out, whether the products are customized for a particular requirement. If your skin, in this case, your skin is ill, the skin is not your normal skin, as Tulsi said, that my skin was thin. The barrier is gone. It's weak. It's damaged. So you need something which will, repair that. So you have to look for that. But how do you look for that? And what should you look for that? Look for a product, and how do you know whether it's there? I think we'll go ahead and, as we move ahead, we'll know that. So I think Dr. Asin can maybe throw light on that.
Chetan, can I just come in a moment here?
Sure, absolutely. I'd love to
Yeah,
get your
yeah. Yeah. See, I see that gentle and safe. See, gentle. Most doctors and most patients would take it as a sale talk, but what we do understand is safe. Safe. We understand that there has been a clinical trial, and it has shown that there has not been any adverse effect. And what gentle at the end of the day is what one perceives. It's a very subjective phenomenon. Safe, definitely there are objective criteria. So when you say gentle and safe, what I hear is safe, not gentle and safe.
No, I think absolutely, because I think when any one of us looks at this area, because these are very commonly used terms and terminologies which you see on the product pack itself. And this is where I would love to invite Dr. Asin, because he being in the research side for so many years, and an expert, especially in the area of the skin, and having done, I think, more than 2 decades of work in this area. Dr. Asin, I would like to introduce this concept, which I think, I'm not sure many people have heard it. It's called as the dirty 10. What's this dirty 10 about, and what's your view about the gentle and safe?
Wow. So thanks, Chetan. And I'll begin from where Dr. Nagaraj has left. So very particularly, gentle for me cannot be gentle for you, and that's what I think Dr. Nagaraj was pointing out. So and then the safe. So when you look at safe, something which is safe is basically safe for a larger group of people. Even if we do a clinical trial, or even if we do a phase 4 study, we see that 95% of the subjects are being benefited by something which is called as safe. So eventually, if we look at from that perspective, we go back to a very fundamental thing, because we are now discussing about skin, hair, and nail, and skin being the largest organ. It is also I would say portal which is connected directly with the external exogenous factor within the endogenous factor. That's the skin is the only such a big organ which is not endogenously found, like the way stomach is inside, like the way liver is inside, like the way lungs are inside. But skin is something which keeps on interacting with the external environment also at the same time. So it has always exposed. It has been always exposed, as said correctly by Dr. Basade. It is being exposed to the sun. It is being exposed to the pollution, and it is also being exposed to the lights which are now called as the man-made lights, like blue lights or infrared lights. In fact, the radiations. So it is taking care of that, and more since last 50 years, if you see the assault of the man-made chemicals has increased substantially. I would say not just the various types of light or various types of pollutant. Also, there is a concept getting very famous in molecular biology and biological chemistry, is the EDC. These are the chemicals which are known as endocrine disrupting chemicals. They are now found more in the human usage. For example, pesticide. 90% of the food which is being infested by pesticide they have the tendency to disrupt the endocrine system, and they can create a lot of changes in the blood. And there are the chemicals. These are the chemicals which can even pass through the skin, and they can get into systemic circulation. And that is why these are the dirty 10 which are listed over here, makes a huge selection parameter. I would say these are the 10 filters when where people could see simply which is mentioned on the product to product, label to label, or individual product, and you can find it out whether the existing product which you are using at any given point of time, if they are containing these 10 ingredient. Although each of these 10 would have a different way of interacting with your skin, affecting the skin, and again going in the systemic circulation, causing a chain or a ripple effect out of that. So the most commonly seen skin irritant, which is tagged as a skin irritant, is sodium lauryl sulfate, or sodium lauryl sulfate. Basically, SLS was very initially was used as a dishwasher. But over a period of time, people started also using this in the bathing preparations. Then BHA and BHT. So these are antioxidant. So BHA is generally used to preserve the oils, so that they don't degrade fast. And that has been put also at the time. They are also found in the edible oils. Although various countries have put ban on them, but still people want to keep the shelf life of oil, whether it is external application oil, moisturizer. It can be also found in the serums, skin serums. Wherever there is a oil, people want to preserve it, increase the shelf life, so they put BHA and BHT, which is basically carcinogen. If it is taken for a longer time, and the quantity of BHA and BHT exceeds to a certain percentage, then there are a lot of dyes. So we generally use these dyes for dark hair. So dark hair, the shades which are like dark black, jade black, and brown. So the phenyl adenine, which is very, very corrosive kind of a chemical, which can also lead to systemic absorption. And this is how systemic means this chemical from skin or hair can get inside the blood also. So this is called as systemic absorption. It can reach to systemic absorption and can create various problems, right? They are also one of the EDCs, endocrine disrupting chemicals. Then we have a DEA. Now, DEA is the substance which is found in lot of surfactant, and this can lead to problems, which is suddenly stripping out the water from the skin, disrupting the skin's barrier effect. In fact, also it can lead to a problem which is known as a microinflammation at times. Okay, so then dibutyl phthalates. Phthalates are basically ingredients, chemical ingredients, which are used as an insecticide in certain cases. But at the same time, since they are a very strong antimicrobial, so people use this to increase the shelf life. Similarly, formaldehydes releasing preservative. Now, formaldehyde is kind of a formalin. I'll tell you what is formalin. In when we were into our anatomy classes in the beginning of our educational courses, so bodies used to be preserved, dead bodies used to be preserved under formalin, so that there is no chemical growth, there is no microbial growth, there is no decay, necrosis of the body, to avoid that. So formaldehyde is a chemical substituent which is a very strong antibiotic. So it can also impact the normal skin rather than impacting the bacterial growth. It can also impact the normal skin. So formaldehyde releasing preservatives are very common. They are present in the products so that people can use them to increase the shelf life. Again, what happens generally when you see people using cream, open cream from the bucket, so or a bottle which is a wide mouth bottle, people keep putting fingers. Fingers are generally, if they are sterile, then good. If they are not sterile, then they will keep on using them again and again. and which can lead to growth of a fungus inside the cream. To avoid the fungal growth, people generally, the companies, they put formaldehyde releasing chemicals, so that despite of using it again and again, there can be no bacterial growth in the cream. So like that, parabens, many of us know about the parabens. And they are the largest chemicals which are used as preservative in food product. They are used also as preservative in topical products. Similarly, perfumes. Perfumes are, although not straightforward impacting on systemic absorption, yes, but they can create certain neurotoxicities. And this is how they can, create an imbalance between the skin and the reactive neurons. So they can create allergies. They can also create a specific area-wise, hypersensitivity. So there are certain perfumes in Western countries. They have listed out the chemical ingredients within the perfumes, and they have banned those ingredients so that they are not being used. But then, very few people are aware of it. Again, siloxanes, they are kind of a silicones, generally used for increasing the conditioning effect, spreadability of any oil or cream. Although they are harmful because they can disrupt the barrier, skin barrier. And triclosan is again the preservative, which is used mostly in the soap, which is also used mostly in the cream, like acne controlling cream, antibacterial creams, etc. So these are the 10 ingredients. By and large, lot of clinical studies, a lot of molecular biological studies and degradation studies, including the genetic genotoxicity studies, has been conducted. And basis on this, a group of scientists who are working with the European Union, they have classified this as dirty 10.
I think, Dr. Asin, you just mentioned a very important point. So there are two questions that we have. One will be for Dr. Nagaraj, where we have Tushar asking us that normally, in his own experience, that some of the cancer patients, Dr. Nagaraj, you do advise them with gentle cleansers because of the challenges that in some of the patients you have in radiation on their skin. How often do you advise gentle cleansers to your patients?
Yeah, see, all of the hygiene is a very important part of the daily routine. And what we do is generally something like a baby Johnson soap, etc., which is supposed to be gentle on the baby's skin. I heard somebody saying that we should treat them like what we would treat the baby. In the same way, generally, baby Johnson soap, that which we recommend. Certainly, I don't recommend Dettol and then chlorhexidine or something of that kind. And I was, I was surprised that most of this, the dirty 10, I guess, are FDA approved. And I do know that some of them do get, used as in the creams. And I also look at the alcohol content. Sometimes some of them have alcohol, I guess, as part of it. So if it is high in alcohol, that cream or whatever, we don't use. I don't use them.
Thanks. And I think that those are extremely important. We also
look at the pH also.
pH, absolutely. Okay, so pH is definitely a very important element. I think there were two questions that we are now getting. One is from Chetna, where she says that in patients who undergo decoloration of the nail, they are advising nail paints. How do these nail paints make a difference? So I'll ask Dr. Asin first, and then, of course, for the psychological part, to Jayatri. So, Dr. Asin, what are your views about the nail paints that are currently available in the market, and what are the challenges they can face to patients who are having these decoloration?
Right. So I think the answer is straightforward, because they have a cosmetically, I would say a question which keeps on tinkling in their mind is that their nails are not, healthy, and they are not looking good. So from the cosmetic perspective, yes, they should have some preparations, which removes that kind of or which is basically masking their nail degeneration. But most of these nail paints which are available are basically formulated for cosmetic purpose and for healthy individuals, who do not have issues related to acetone based, nail paint, or who do not have issue with the alcohol based, colors, and who also do not have issues with uh, the corrosive pigments, because all these colors, the moment it comes, when you say color, whether it is in fabrics, whether it is in food, or whether it is in other than what you see in vegetables, bell pepper or red pepper or carotenes, other than this, all the synthetic colors can trigger a lot of allergic reaction, especially in the immunocompromised subjects. So that is where I always make a point for people that they can come out with something which is like a aqueous, based skin, nail color. But again, aqueous based nail color has its own disadvantages. Like it can be washed off with simple, when you're trying to wash off some, say, stencils, or you're washing your hand, it can be taken out. So just for a momentary purpose, I always suggest, if somebody is using a aqueous based nail polish for occasional use. Otherwise, then there is a second option where we have a polymer which can be peeled off simply, and that doesn't get inside your food or a pigment, and that we can make the nail paint with the polymers which are safer eventually.
Wonderful. Thanks for that. I think we have two people who have raised their hands. Tangam, what are your thoughts?
See, and there are not thoughts, there are so many questions in my head. Looking at the dirty 10, I am now 64 years old. How many of this dirty 10 has gotten into my system? I'm just wondering. I'm not sure. So it's like, when we are not aware of what is there in the market, and touch wood, okay, we do have different types of skin, dry skin and all that. When I was younger, I had acne prone skin, so that time my entire focus was to get rid of acne. Now it is to ensure that my skin remains moisturized. And when you're talking about these, nails, all my life I have put nail paint, and now if I don't put, I don't like my nails. So it may be because of all the harsh chemicals that I have put. Same thing with my hair also. So I think this is something that, most of the public is not aware. And it's good that the dialogue or the narrative is now starting with the sensitive skin. And I know oncology patients, they definitely deserve better attention and better education, that all the products which are available are, they are not safe for them, because their skin is far more vulnerable than all of us. So yes, I'll not forget the dirty 10. And I happened to take out my Nivea cream, and I started reading which of the dirty 10 is there in the lotion. So I just saw alcohol multiple times, and it's supposed to be moisturizing my skin, but I don't know why so many times there are different types of ethanol and alcohol in the Nivea. So I'm getting heightened with all this discussion, but the focus is on, sensitive skin. And I also think that sensitive skin is not only for onco patients. There are other categories of patients who have extremely sensitive skin when they are in the critical care. I have my mother who is 84 years old sitting at home, and I'm really struggling to ensure that her skin is, it looks hydrated, but it's extremely dry. Anything that I apply, she'll say it is itching. So I am kind of at a loss that what to change. So my brother suggested a cream. I'm trying that. So these kind of problems, there are millions of people who are facing, not only the patients, the people who are taking care of them, and elderly population, and there are other critically ill patients whose skin become very, very sensitive. And nurses are at the, they're at a loss how to take care of the skin. So I'm extremely glad that such discussions are happening. And yeah, these discussions can be a little frightening, to normal people also. Can you imagine? Thank you, Dr. Asin, for that dirty
Thanks.
10 for sure.
Thank you so much.
I think when we hear about certain terminologies, it sticks to us. And I think we have a question for Jayatri where Priyadarshini is saying that my sister has lost all her hair. So she is planning to shave her head to show her support to her sister. Will that make her happy? What would be your view, Jayatri, for that?
Priyadarshini, it's an amazing question. And also in today's panel discussion, we have so many caregivers also. So I'm sure that they can understand the pain now currently you are undergoing and why you really wanted to do that. So when I was listening to your question, I could remember a video that I saw probably 2 months back, where one little boy was, kind of shaved his hair because his younger brother was receiving chemotherapy. And also he lost all the hair. So coming to your question that, in the earlier question that was asked by Mr. Chetan, that I said, why is more important than what? I do agree that probably you love your sister a lot, but again, it's very important for you to understand that what are the reason that, you would like to do that. And I'm sure that either you are a student or you are a working professional. So the moment you are going back to your school or workplace, you need to think from that perspective as well. So always try to choose a very realistic approach. Yes, we do love our sister or brother or sibling a lot, but again, it's important that what problem I can experience at the end of the day if I take that step. If you feel that no, fine, whatever problems will come in my way, it doesn't make sense for me because my sister is my priority, then please go ahead. Also, if you feel that no, the problems I may experience, I will probably not be able to tolerate all those comments or probably, some XYZ, and it can be done by anyone. So you need to take your decisions depending upon absolutely your own preferences. And again, the cost benefit analysis, as I spoke earlier as well, that why is more important than what. So there should not be any definite answer from my side, surely.
Thanks. So we have also some questions from Swarnlata, where she basically says that patients who lose hair during therapy, do you recommend certain hair serums or some hair attachments and wigs? What would be your view, Jayatri?
Okay, so first of all, if I get any questions as such, trust me, what I tell them that please go back to oncologist and ask them.
Okay.
Because as a psychologist, truly no false answer, no wrong thing. I'm not in a position to say to the patient, and that's completely unethical. So the best thing that I do that I tell them, please you go talk to your consultant oncologist and he knows your medical history since day one. And probably I am seeing you only for the first time. So it's always better to take the right decision from the right person.
Dr. Asin, what would be your view? Because the way alopecia happens in cancer patients, it's very different to how alopecia would happen to normal people. I think we'll touch upon this answer in the next coming slides because we have few things which we can share on this area. Now, one thing which I think definitely we will encourage each and every person who is there on this telecast is when you pick up your so-called as safe and gentle product, which you have in your, for shower or for your moisturizing. Please check that whether your favorite product, which has certain claims, and they are valid claims for people who are normal, but here we are talking about people who have distressed skin, they are immunocompromised. How many of them have these dirty 10? Because when we looked at that landscape, we found, to our surprise, many of them. So we would request you to honestly look at it, because if you have some of these irritants or products which are not meant for you, then those are going to create more problems for you on the long term. And as survivorship increases in cancer because of better treatment, these are something which is extremely important for you to look at, because it's just not for 1 day or 2 days. That's how you have to then have that habit or lifestyle which Amit was talking to. So Amit had raised his hand. So Amit, to your point.
So one very interesting fact, we all have nicknames like Chotu, Motu, Monu, Sonu. Similarly, this Dirty 10 also have a lot of nicknames, and a lot of products will mask the real name by using the nickname. So that's another thing which we need to be aware about. But it always begins with at least starting with the main name.
I think a very common thing is SLS, sodium lauryl sulfate. Please look out if the product that you have, does it have this ingredient? And I can tell you, it has surprised many of us. Okay, because we have seen these products or this ingredient even in baby products. So that's how it's being used, and hence when it comes to patients or specifically cancer patients, we have to be very, very careful. So with that, we now move into what are clean ingredients, and what does it take to bring these clean ingredients, which are dermatologically tested, which are made for patients who are immunocompromised, because that part is going to be an extremely important part of the storytelling. Because many a times we are blinded because not because we don't know, but more because this information is something we never looked at in the past. Now, when you start looking out for information with better education or better understanding, then I think we can make informed choices. So with that, I would request Amit and Dr. Asin to basically share with us how did we go about curating some of these products in Vidhyou? Because I think that was, the cornerstone of the belief that we had. So what were your thoughts and your approach when we say it was designed for safety? Dr. Asin, Amit.
Yeah, so I think we need to understand that safety does not come by default. Safety has to be designed. So it has to be safety by design. And I think Dr. Asin very beautifully explained to us the dirty 10. So it all begins with how do you build products by excluding all the irritants. And I think he explained that part very beautifully. So that's number one. But then the proof of the pudding is in eating it. So when you create a product, the proof of safety is when you test the product. So that is exactly what you should look for. That has the product been tested dermatologically? Now, dermatological testing also is of various types. I'll give you just two options. One is testing on a normal skin, and a more difficult challenge is to test a product on sensitive skin, because sensitive skin people, even rain can cause irritation. Rainwater can cause irritation to sensitive skin. So it's that sensitive. Now, we had the choice of testing products either on normal skin or on sensitive skin. But as Dr. Asin said, that we have done our best to exclude every irritant possible from the product. So we chose to take the more difficult challenge, which is testing the product on sensitive skin. And I think we are very happy and proud to say that our products have been tested dermatologically by a dermatologist and on sensitive skin people, and they're found to be non-irritant. So because dermatological testing is nowadays used very lightly. So from a informed choice point of view, I think people who have some compromised skin or sensitive skin have to make sure that they look for products which have been tested specifically on sensitive skin and by a dermatologist. So I think that's short this thing from in terms of safety.
So Dr. Asin, we heard Dr. Nagaraj mention to us that because of the newer radiation and also from Dr. Basari, how does this make a difference to a radiation or a patient who is undergoing radiation? Or how does this make a difference? Not having these irritants make a difference to these patients?
See, yeah, Chetan, thanks. This is a very good question, because there is a phrase, people say that they are in search of a truth. Now, when they search, generally they try to find it from outside.
but I say that truth is always inside, So the very fact is that the one who's using the product, the very first thing he has to know his own level of sensitivity. And I would just add to one test which they can always do when it comes to a topical product. They can always, do a patch test, with their own self before even applying, if they are highly sensitive, individuals. Now, if I go back to highly sensitive individual, and look at the demography of it, so only 0.1% comes under a very, very high sensitivity level, so which means that 1 in 1,000. If you get into sensitive skin, because of now continuous usage of the perfumes and deodorants and harsh chemicals or those dirty tints, now sensitivity cases are increasing in last 10 years. If you look at the Dermatological Association data, the higher sensitivity is based because of the high level of the infrared and radiation exposure, eventually. So nowadays it's 3 to 4 per 100. You would find a very sensitive skin kind of people. And then comes the immunocompromised skin, Now, immunocompromised skin is again a larger population. A candidate who's taking anything which is known as a long-term steroid therapy, is also a candidate who's immunocompromised. A candidate who's also taking a product post organ replacement or during the organ replacement, whatever therapy is happening, is again a candidate of immunocompromised skin. And similarly, a candidate who's on cancer treatment for a long time, for multiple cycles of chemotherapy, is also a candidate of immunocompromised skin. A candidate who's taking the tuberculosis medication, probably he's also a candidate of immunocompromised skin. Similarly, a candidate who's having a skin allergy is also a kind of a immunocompromised. So now if you look category of this immunocompromised skin, more than 78%. Okay, out of 100 who have skin problem, more than 78% people come under the immunocompromised skin. Now, how do they look into this area, and how do we understand our body or ourselves? How do I empower everyone? That's the challenge. That will come gradually over a period of sessions and webinars and seminars. But the very first thing is that the right thumb rule is basically you will have to follow the nature. So there are products which are made from pure butter, or oils which are pure oils or organic oils, and the maximum percentage of the product so far, like 40-45%, comes from a purely natural source. The way we have created our moisturizing cream, the cocoa butters and oils which we have used, the oleo-based ingredient which we have used. So that has been formulated in such a way that in most of the cases they can be easily acclimatized by the user. Okay. At the same time, if you look at the very, very high sensitive skin people, for them anything can be can create a sensitivity. As Amit was saying, that even water can create a sensitivity. For them, that is the reason why everyone has to go back and check the sensitivity of that particular product behind their earlobe and then start using the product. That is the first thing. Second thing, while selecting any product, you will have to look at the not the active ingredient. Don't look at how much pomegranate it is having. Don't look at how much cucumber it is having. Don't look how much Centella asiatica or Brahmi it is having, or aloe vera it is having, because it is always, you will see, not more than 1%, including all the ingredient. So you have to look at the other ingredient, other side of it. Like the maximum percentage of personal care ingredient would be water. Of course, everything is water or oil based. The second number of ingredient, the number 2 ingredient, you will have to check. So what is the number 2 ingredient? Whether it is surfactant, or whether it is a petroleum product, whether it is basically a product which is silicone, which is used for spreading of that particular product. So you'll have to look at number, number from the diminishing quantity. Like for example, the highest quantity would be water, then the second, then the third. So that way you have to look at the product, and then you can simply decide whether you are selecting a right product for you or not. So these are very few things from which we can go ahead and decide what product are good. Nowadays, you will find a product, very rarely find products which are stamping or which are mentioning on the product that clinically tested or dermatologically tested. If it is a food ingredient, you have to say clinically tested, or if it is a skin-based ingredient, you have to see a dermatologically tested stamp. So all these are the basic criterias for a layman to understand and to find out whether they are selecting a right product for them or not. Yes, Chetan, over to you.
So I think very specifically, do you think that even radiation patients can take these products, and once we have eliminated these irritants, it will be useful?
Very true. I mean, see, I'll tell you, any sensitivity is the byproduct of inflammation.
Okay.
Whether it is inflammation created because of the UVA, sun's radiation, okay, whether it is the inflammation which is created by continuous sun exposure, which is sunburn is also creating the inflammation in the skin. Similarly, a normal radiation, and then a patient who is into radiation because he's taking a radiation which is 40 gyron and plus more than that. I think it would be more explained by Dr. Nagaraj here, who's here. At times you have to give higher radiation ratio. So in that case, it is this radiation is tend to strip off the water first, strip off the barrier, skin barrier, and at time it can create a desquamation. Desquamation means it can, you know how the flakes, rice flakes look like. It can create a normal skin cell into a skin flake. So that is known as a desquamation process. Now, desquamation process can be grade 1, grade 2, grade 3, and grade 4. In grade 3, the flakes of the skin, they turn moist. And grade 4, it turns into ulcer. The radiation injury can be as high as ulcer, ulcerative injuries, which heals very slowly. So that is where we have formulated this product so that grade 1 and grade 2, radiation based injuries can be healed with these products.
Wonderful, wonderful, wonderful. Thank you so much. And I think this was extremely important, that the way the product has been created has just not looked at the exclusion, but we have also looked at what are the elements which are important. And so Vishal and Amit, there is the new recommendations that are coming up globally. So can you then share your thoughts, because we spoke about how cleansing was important with gentle products, how moisturizing was important, and how protecting was important. Can you share your thoughts on this new me, which is a new habit that patients now have to really look at?
So thank you, Chetan. And it was actually very enlightening to hear all the eminent speakers express their thoughts, their experience, and their guidance. And I think that falls right in place, that new protocol, the new regimen of cleansing, moisturizing and protection is becoming very important now. And that is, I think, where that new me is arriving, because all the cancer survivors, the warriors, they require something as not only something which is after treatment, but right from when they go on to the doctor and want to get on to the treatment protocol. And that is where the preemptive conditioning of the skin will start. And that is where I think Vidhyou steps in with the products. I wouldn't say products, they are the solutions to these side effect management for the skin problems. And that is where the cleansing part is being taken by the Vidhyou shampoo and the Vidhyou body cleanser. And these have very important ingredients, as we know that they are high performing bioactives, which help the skin not only be safe, but also it repairs the skin internally. It maintains the required moisture, and the effect is definitely seen on the skin. Similarly, as far when we come to the regimen of moisturizing, Vidhyou has a moisturizer which not only has natural ceramides, it not only has natural peptides, but also a higher version of hyaluronic acid, which we know as hydrolyzed hyaluronic acid. Now, all put together, they not only repair the skin barrier which is broken or damaged, but they also have that moisturizing effect for a longer time. And that is what I think is required today to maintain that moisturizing throughout the day. And last but not the least, it is the protection which Vidhyou sunscreen offers. And this sunscreen, as we know, it is tinted, having natural minerals. So it adds on to the effect of protecting the skin. We have also heard that a normal sunscreen would ideally make the skin dry. But the Vidhyou sunscreen not only protects the skin from UV radiation, but also it gives the moisturizing effect because of the moisturizer that it has from within. So it has a dual effect. And Amit, if you would like to add something to this?
I think when you mentioned about the new me, I actually, it reminded me of what Tulsi said. Tulsi said that I was my version 2.0. I think the new me is about the 2.0 for every patient. And I think, Tulsi, this we got inspired from you, and hence we brought this 2.0 as a new me in this conversation, where the cleansing, moisturizing, and protecting with absolutely gentle and effective. And when we say gentle, it is genuinely gentle, because the first thing we don't have in it is we don't have the dirty 10 in it, and that has been excluded. But more importantly, we have other things that have been added on to that. So thanks a lot for that, Tulsi. Amit, your thoughts, please.
Yes, Chetan, we can go to the next slide because I think it's much easier to explain there. So this is how, any customization begins with understanding of the needs. And, a mother can customize her help to the child because she knows his needs or her needs. And this is what we have tried to do, that what are the cancer patients' needs, and then try to, build all those solutions in the product. So for example, to give you a simple example, a lot of patients that we spoke to said that we apply moisturizers, but the effect is, it dwindles and it fades within 1 hour or 2 hours. And we have to again keep on applying it. And that is because the skin barrier is broken. As Tulsi said, skin had become thin. So until and unless there is something in the moisturizer which restores the skin barrier, the moisture will not get locked inside. So moisturization is essential, but restoring that skin barrier is also essential at the same time. And so is soothing the skin, because cancer patients have a red irritation, inflammation of the skin. And somebody spoke about, the smells. So aromatherapy, which means that good smells which can relax you, which can soothe you, are also that important. But the challenge is, how do you take 1, 2, 3, 4 and put it all in the same product? But that is what we have tried to do, that we've tried to take those 4 needs, find 4 solutions, and then, add all of them to one single product. So that is how the moisturizer got built. And as Vishal explained that, it has ingredients which can restore the broken or damaged barrier, like natural ceramides. It has a special type of hyaluronic acid, because your skin, if it is right now damaged or compromised, the normal hyaluronic acid which is available will not be able to moisturize it properly. So it has an advanced grade of hyaluronic acid which can penetrate easily into the skin and lock in the moisture. And as I said, aromatherapy, which will soothe the senses. So it is about 4 products put into one single product. So when you look at the moisturizer, it is actually a soothing product, a product which restores your skin barrier, moisturizes, and also, aromatherapy. So 4 products combined into one. I think so that's the beauty of it.
I think when we look at customization, and I think this was another area which I think Vishal had mentioned, where he said that, when we look at even the Harvard Health publication, where the Harvard Medical School talks about cancer, a very recent article in 2023 said that rather than using some of these chemical-based sunscreens, which look very attractive, they glow, having mineral sunscreens which are tinted, and the most important thing is most of the sunscreens dries your skin. So when customization happens, is that's when you incorporate moisturizer into the sunscreen, and with something like a mineral sunscreen, you still achieve something of an SPF which is more than 40. Now, when we have to put all of these things together, and I know, and Dr. Rasin knows about it very well, and so does Vishal and Amit, that when we had to get an SPF 40 on a mineral sunscreen, these ingredients had to be imported from a proprietary company. And to build these products, which are so very safe for cancer patients, actually needs customization. And I think that's where each and every product, be it the sunscreen, be it the moisturizer, be it the body wash or the body cleanser, or the shampoo, which is for sensitive scalp, uh, everything was thought from a cancer patient's perspective, and hence it was built. And I like the perspective that Amit brings onto the table, saying that unless and until you don't customize it, then you will lose out somewhere either to the dirty 10, or you lose out from having things which are not important or would not give you the result that you are expecting. And with that, I would like to basically request Dr. Rasin that when we summarize and we say that it's all about building new habits and creating customized solutions, I don't think so it's about products, but solutions. But most important, I think each one of us from this interaction, I think today at least will be taking one message, and that is please check for the dirty 10. Because if they are there, that means they are potential irritants that any of our uh, you know members or family members who have cancer, we may subject them to challenges which we otherwise are ignorant about. But I think the more important thing are forums like this, where where we get a lot of ideas. Like, for example, right now we had an idea coming up that think about something that is for the nails for cancer patients, because the nail paints which are currently available as cosmetics, they are high chemicals. They have, and we have had points which came up from patients where when they take that smell, they can't tolerate that smell of that nail paint. And that's because they are not meant for cancer patients. They are meant for normal people, because then for removing them you need acetones. So similarly, I think each of these conversations, and I think as we design more conversations in the future, I think what we will look forward to is getting from you what are the challenges, so that we can then build products and solutions which can make a difference in the lives of people. And I think that's where we would like to very quickly summarize. And I would request Vishal to basically share that in case you wish to give this to your loved ones or you want to use these products, over to you, Vishal.
So we have actually felt the need that these products should be accessible to everyone, right? Because we end up in the marketplace searching for all sorts of products, but the specific ones that we want are not really available at the click. So we have made it very accessible to all. First and foremost, you can log on to our official website, that is www.vidhyou.com, that is vidhyou.com, or for convenience sake, it is also available on Amazon and Tata 1mg. Apart from that, if you really want to have more information about the product, just WhatsApp us on the number on the screen by just sending a hi, HI, and we will definitely get back to you.
And this is not all, and thanks, Vishal, because we are also tying up with other marketplaces. One of them which we are currently contemplating is OncoBuddy. But as we move forward, we would be present in places where people can access our products. But most importantly, it's about building a community. It's about building a community where an interaction like this, where for the first time we have doctors, we have patients, we have psychologists, we have nurses, uh, all coming together, and experts from the industry coming together to discuss a problem. And I think this is the first of its venture that we are looking at, and we are extremely thankful to each and every person who has made this 2 hours wonderful. I'm very happy that we have tried to keep it in the 2 hours that we had committed to. But I can tell you that we had close to 400 registrations for this event, and that was from 60 cities and 10 countries around the world. What we are also happy is that this event will be broadcasted on YouTube. So if some of us wants to share that with some of the people whom we believe and we love, it will be open for everyone. So I want to thank each and every person. And Amit, before I close out, oh yeah.
Yeah, Chetan, before we wrap up, we can spend 2 minutes for a quick survey.
Oh, okay.
5 questions. So I
No,
thought
I
I'd just
think
remind you.
Amit wants to have a before and after. So I will use this
Priyanshi, I think maybe we can,
thank each and
quickly
every
start.
one of you, and
Simple
then pass
questions,
it on
just
to Amit to conduct the survey. But every panelist, all the experts that we have, Dr. Basade, Dr. Nagaraj, everyone, Dr. Asin for their wonderful comments. Tangam, we have Nurse Saili, Jayatri, brilliant inputs from you. Tulsi, we loved every aspect of what you shared. So was the thoughts from Natasha. And then I think Garima, Amit, and Vishal have brought their own flavors, which was so important as we constructed the next level of care that we believe that every patient deserves. And with that, Amit, over to you for your survey.
Thanks, Chetan. Thanks. Thank you, everyone. And then before we wrap up, just a quick thing of how our understanding has changed after the webinar. So Priyanshi, if you can flash the questions. Yes. So you must be seeing the question on your screen. You just have to hit one option. So following simple skincare habits or routines before starting cancer treatment can prevent or reduce skin side effects. If you think this is correct, please hit yes. If not, no, or if you're not sure, not sure. This is the next question. Popular skincare products may contain skin irritants and chemical preservatives which can harm the delicate skin of cancer patients and cancer survivors. So based on the discussion, if you agree with the statement, please say I agree, or else if you do not agree, then option B, and if you're not sure, C. Question number 3. Products which claim to be dermatologically tested and safe for skin. Are these products definitely safe for people facing cancer and cancer survivors, or do you have to check for something else as well? Okay, it's the 4th one. Which type of sunscreen is recommended by dermatologists for people facing cancer and for cancer survivors? So are mineral sunscreens good? Are non-mineral sunscreens good? Are tinted mineral sunscreens better than mineral sunscreens, or any sunscreen of a popular brand? We can go to the next one. Do you know of any brand of skincare which is customized for people facing cancer and cancer survivors? So now that we've had this discussion, do you know of any brand? Yes, if you know it. No, if you don't know. Yes, if you know of some brand, but which is not available in India, or not sure. Yes, and most importantly, if you would like to know more and try out Vidhyou products, please choose the correct option. That's it. I think this was the last question. Thanks,
Wonderful.
Priyansh. Thanks, Priyansh.
And thank you so much, Amit, for running the survey. I think we have the before and after now with almost practically the same questions. But thank you, everyone. I think it's been a long evening, but it was wonderful having all of you. Please reach out to us if you have any questions. And I think Tangam said that, he needs to understand more about the dirty 10. So I think that's something which will be discussed more as we also create more products for cancer patients. So thank you all and good night.
Thank you. Thank you, everyone. Thanks, Chetan.
Thanks.